Victoria's daily cases are climbing close to 300 and there's growing clusters in New South Wales. Some scientists are saying without a vaccine, the key exit strategy is herd immunity, learning to live with it and putting out spot fires when they occur. Infectious diseases physician from ANU, Professor Peter Collignon, joins me from Canberra with the latest on the virus. Peter, thank you for joining us. Do you see Sydney having a Melbourne-style second lockdown anytime soon?
Well, I hope not. So far, what they've got is a cluster, particularly associated with a hotel. And New South Wales Health seems to be doing a very good job at tracking all those people down, isolating infected cases, quarantining people, and doing lots of testing. So my hope is that this will be contained and we won't get any community spread. And I might point out, Sydney has been in a better position than Melbourne in any case, because Melbourne, in retrospect, if you look at their community transmission, they've had low levels since May. So this isn't just a recent event. This is actually quite different to Sydney, where there's been ongoing cases for quite a while that's just rapidly accelerated over the last couple of weeks. So we could have expected, because it's winter and viruses spread more easily, that we would have had small outbreaks and problems during winter. Maybe this is what you might have expected in Sydney. I guess a lot of people, including myself, were predicting this. One hopes it will get under control and expects it will get under control, so we won't see the same situation as Melbourne.
Now, Professor, you've used the term ring fencing as an approach that New South Wales could adopt. Can you explain what you mean by that?
Well, ring fencing means you find areas where outbreaks occurred. It's a bit like spot fires, and you do everything you can to find everybody in that area that may have COVID, ring fence them as much as possible so that they don't travel too far, etc., and basically get the transmission of COVID down to really low levels. One of the issues with COVID is that we've been very successful in Australia. Even with Melbourne, it's still got low rates compared to, say, the US and Europe. But it is a worry there because it's not under control yet. But basically, some people are talking about elimination. I think that's a concern using the term, mainly because I don't think it's sustainable in the medium to long term. With our current or strategy that Australia has had, it's been of keeping it suppressed to really low levels. And I think that's the best way to go, because you will succeed in probably eliminating the virus from some cities and areas. But what it means is you've got to expect there's low levels of virus there, that if you don't keep on doing all the things that suppress droplets being spread from person to person, it will flare up and you'll get, fires and spread. But if you use the term elimination, everybody says, well, we don't have the virus. Why do we have to do anything different? And the reality is, until we get a safe and effective vaccine, widespread use, which is probably another couple of years, we are going to have to continue to do things differently than a year ago, keep crowds down, particularly inside, and avoid sending our droplets to others and getting other people's droplets as much as possible for quite a while. And that means curtailing some of the things we would otherwise like to do.
Now, are you someone who advocates mask wearing? Because there seems to be a lot of mixed advice about the usefulness of wearing a mask, particularly if you are social distancing. What is your advice on masks?
Well, if you can keep your physical distancing, more than 1.5 metres away, you probably don't need a mask. And it also depends on how common the infection is being transmitted in the community where you live. So in the US and most of Europe at the moment, I would advise wearing masks when you are in crowds you can't avoid, such as public transport, or in a job where you just can't avoid being close to people. In Australia, I think it's different. In Melbourne, currently, there is enough community transmission to warrant wearing masks in public transport and lots of other places. I would think at the moment, not in Brisbane, Adelaide or Perth. Sydney, probably not either, because at the moment it's just a cluster, but we'll just have to see where that goes. But we need to do what we can to decrease the spread of droplets to others. And masks are mainly a protection, or more of a protection to others than ourselves. Because if we've got a mask on and we cough or sneeze, it mainly gets confined to our face rather than spreading over others. There are other things you can do as well. If you're in an occupation, for instance, where it's hard to avoid others and get close to them, such as a waiter or a waitress, such as wearing a face shield, a clear face shield that protects both you from getting their droplets on your face, but you sending it to others, and also stops you inadvertently touching your eyes, your nose and your mouth that we all do subconsciously so often.
Well, that's a whole nother step, isn't it? The face shields. That's a fairly dramatic escalation, something else to get accustomed to, I guess. I want to ask you about Victoria, 270 new cases today, but the most worrying thing seems to be the positive test rate is higher than it's ever been, considerably higher than some previous days where there's been a lot of positives. Is that something to worry about, that we're getting so many more positives from a smaller group being tested?
Well, I'm not sure it's a smaller total number being tested, but it is a worry that the positivity rate goes up. When we have a positivity rate of less than 1%, you think you're really picking up most of the cases. But when it starts rising, you worry about how many cases you're missing. Now, you can get an artificially low and false security by a low positivity rate, and I think Victoria was in that situation. They did a lot of testing on asymptomatic people, and they still want to do that. Now, the yield from that, I think, is pretty marginal unless you're trying to do an epidemiological study, because even if I get tested today and I'm negative, what's to say I won't have the virus in 2 or 3 days' time? So I think where we need to concentrate our testing on is people with symptoms, because they're more likely to have the virus. And secondly, if we do asymptomatic people, it's got to be really targeted to be high risk rather than the general population who probably are very low risk. Even in Melbourne at the moment, maybe 1 in 1,000 people in some areas can have the infection or more, but that's still a very low rate compared to a lot of Europe and the US, where it's probably been 1 or 2% at different times, and the cumulative percentage is much higher.
Well, yeah, based on the figures reported today, it's a positive rate of 1.23%. So that through 270 positive tests came from only 21,995 tests. So it's just an increase in what we've seen in recent days. We'll keep an eye on that. And just lastly, you mentioned a vaccine, perhaps it's 2 years away. Can we be confident that there will be a vaccine? And if we don't have one, what's it going to take to get Australia to herd immunity?
Well, the trouble with herd immunity, it usually is thought to require 60 or 70% of the population having immunity because of natural infection. With COVID, that wouldn't seem a good idea. I mean, Sweden is in fact tried that experiment, and they've got 50 times the death rate per head of population than Australia does. So at the moment, I think our best strategy is to keep the infection rate as low as possible until we do get a vaccine. Now, the problem is having a vaccine that's safe and effective isn't a given. Even if you look at influenza vaccine, it's only 30 to 50% effective, and that isn't good enough for a virus that's got probably a 1% mortality overall. So there's probably at least a 50% chance that we will get a vaccine, because there's over 100 candidates being looked at as a vaccine possibility around the world, and you'd think some of those would pay off. But it means really both now and in the medium to long term, we have to think about the things that we know, decrease the risk of us getting infections without paralysing society and paralysing us socially, economically, and all those other ways. And that's basically physical distancing, keeping crowd numbers low, particularly indoors, washing our hands, and people who are sick stay away from work, and we need to stay away from them.
Absolutely. Peter, thank you so much for joining us.
Thank you.